Welcome back. Thank you very much for staying with us. The Health Department says it has made progress in the recruitment of health professionals around the country. Now, this follows recent protests by hundreds of unemployed doctors around the country seeking to be placed in posts in government hospitals. Briefing the media on the state of the health sector as Health Minister Joe Phaahla, he announced that his department has found a solution to the current difficulty employing doctors who want to work in the public service. The Health Minister joins us live now on Full View following that briefing. Minister, good afternoon and thank you very much for your time. So you had a wide-ranging briefing from the non-placement of doctors to the issues at Temba Hospital, which has been closed. Perhaps let's start with Temba Hospital, just as you did. Very concerning. They had to close and not service communities because we had what is termed a business forum that was threatening the CEO. The CEO was once held hostage, and then beyond that they were demanding tenders. What is the status there at Temba Hospital in Kapokweni in Mpumalanga?
Well, we are pleased in the sense that currently the situation has returned to normal. I was there on Wednesday. I met with the MEC and the Premier and the management of the hospital, and also with the staff. Obviously not all the staff, but a good sample and representative organizations of the staff. And we really expressed our disgust as the fact that staff members, starting from the CEO, as you've mentioned, and the CFO and a number of managers over a period of time. This went through just over a month, from early in March and then culminating on the 4th of April when some of the staff members were manhandled and some were hit with chairs and so on. And that's when the staff felt that they can't take it anymore. But we are happy that, working with the province, our colleagues there from the Premier, the MEC and the department, and also the South African Police Service, I had very good support from the Minister and the Commissioner, and order has been restored, and they are now investigating those who, committed this unacceptable, crimes at the hospital.
Now, at the heart of this matter were accusations or allegations by community members in the form of this business forum that there were tenders that were going to specific individuals. They were speaking of some sort of corruption or fraud within Temba Hospital, and anarchy, of course, cannot be entertained. You spoke of those in the community that want to bring certain allegations to your attention. They need to follow proper channels. What are those channels to follow from this point onwards?
Well, there are a number of channels. To start with, the hospital has a fully functional hospital board, which is made up of leaders who are coming from the community. So that's the starting point, that if they believe that a management is guilty of any kind of wrongdoing, they need to raise that with the board. In case that they are not happy with the response of the board, they have the access also to the MEC and the Premier of the province. If they're still not happy with that, they're also very, free to can approach my office at the national level so that we can be able to take up this. None of that was done, but over and above that, I think, if they were really genuine, one would have expected that they would demand fair practices if they believe things were done in a fair manner. But they come to the hospital with a list. They give the management a list and say, from next month or from next week, these are the people who must get all the business services in the hospital. Yes.
No, quite worrying.
So,
into the placement, apologies for interjecting there, just in the interest of time, because there's quite a lot to cover with you. On the non-placement of doctors, you had committed that come the 1st of April, doctors would be placed. We've reported on this extensively. What is the status there? Because we understand there are 2,012 unfunded vacant posts that need you to come up with 2.4 billion.
Well, let me just put that in context. When the whole issue arose early this year, we worked with the union, which is called the South African Medical Association Trade Union, SAMATU for short. Also worked with the association, which is called the South African Medical Association. And we also invited individuals. Our then acting head of department, because the DG was on leave, gave her email so that people could actually submit those names of and details. So they combined everything to look at how many people were actually looking for employment in the public service. We initially had from the unions and associations just over 900. When they combined with those who approached the acting DG directly through the email, they came to a number of just 1,017. And so they've been working on those numbers. And as I speak to you now, in fact, even on the 9th of April, when I met with all the MECs, already the number of jobs which have been offered or already appointed, either appointment letters issued or people already having started work, was 1,103. So it actually surpassed the number which had been submitted. So I'm putting that in context to say the over 2,000 vacancies, this is in terms of posts which have been created in different provinces which have not been funded. It doesn't mean that there are warm bodies of 2,000 people, the doctors who are waiting in the queue. It's simply that in terms of saying this is Mankweng Hospital, this is
what they need.
This is the number of posts which have been identified as at the best. This is what they would need. It's not the fact that those are the people waiting to be employed. Yes.
All right, Doctor, thank you very much for your time. I wish we had more time, because the biggest question now is whether, with so many gaps, what happens then of the NHI? Because SAMA is among your strongest critics that have come out to say that perhaps government is not yet ready for the national health insurance because there are so many gaps insofar as placing doctors, nurses, pharmacists, and even the infrastructure problems. But we'll leave it there for now. That was Dr. Joe Phaahla, Minister of Health, speaking to us.